I would also, for the surgeon's gloves, I would take them out of the paper wrapper.
Yes, that's what I was wondering.
And that's about all you can do as far as getting things ready. And just lay them down just like they were in the wrapper. And you could even lay them up on top of this, because by the time you need those,
She's ready.
right, those are going to be gone. Okay? So anesthesia, I won't usually probably have an anesthesia person up there, will be in charge of turning the head. Okay, so the surgeon's going to come in, probably will have just foamed, so we don't need a drying towel, but I do need you to help me with my gloves. Now, what we didn't do before was assisting the surgeon in open gloving. So just pick it up, pull the fingers down and get rid of the cuff, and go ahead and place your fingers in it like normal. Remember, the thumb should come toward me. I know. Okay, and thumbs underneath too, and fingers, all your fingers. And you just say right. And the only difference, stretch, stretch, stretch. You keep your hands down. The only difference is just watch your fingers on my bare arm. Exactly like that. You can't really like stretch way out and snap it because it hurts. But just kind of keep your, and if you're not going to be sterile, you have to remember to keep your distance. Just when we tell you you can move up to the table, then we tell you you can't. Okay, so I'll let you go ahead and drape. So you're going to take your top towel like this and lay it with this here.
What?
With that diamond on the bottom.
Like that. Just watch your fingers as you're placing it. Now you're going to take one and do it the other way. And I would probably, for this one, protecting your fingers. Good. Except all the way up, all the way, all the way, all the way. So we've squared off their little bitty ear. That's all that should be sticking out. Okay? We don't do clips because they're not going to shift and go anywhere. So now you're going to get that long one, and you have, remember I was saying you have the fill area? You have some here, so I would make it generously overlap. Come in this way. There you go. Just right. I wouldn't even probably go that far, because see, that's already sterile, so if you put it right there, you've got a little bit more. Now you're going to grab your suction and your towel and bring it up, lay it out right here, okay? And you're going to find the end, and it's going to go over here. So just about that. We're going to have to get an extension, okay? And then all of this is going to lay up on here to kind of hold it down, okay? And I mean, you may want to at least have a loop of it, because it needs to be able to reach up here, okay? So you would go ahead and drape that out, and the next thing that the surgeon's going to want is a speculum. So if you want to pass from over there, you can. If you want to pass from here, you can. Oh, leave it, leave it, leave it, leave it, leave it. You don't need that little one anyway, right? Yeah. And as you move your table, you kind of have to get used to kind of putting your hands on top. And if you push down, some of the wheels, I mean, even at the hospital, are so bad that it makes it really hard. Okay? So if you need to bring it, or your circulators could bring it up for you, but you want to stand about right there. And you're not sterile, but the table's not sterile either. So that's the only thing you need to worry about, how close you're getting to it in the drapes. So how about and the surgeon won't ask you what size, you just kind of make a judgment. Scrape, 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 and then they'll drag out all this growth. And they'll lay their things back and then it's your job to get them. Okay. Did you guys all see how he passed it with it down? Some doctors like it this way and some use it like this and kind of make their incision going up. Depends on the doctor, but I use it going down. Okay, and then this is next. As long as it's right there for me to grab, I can get it myself. Collarbone. And then I would place it, drops. Circulators need to have the drops handy and be right over my shoulder. And you're just gonna reach over and I want 2 drops. Drop, drop. It'd be better coming from this way so you don't reach over the sterile field and then cotton. Okay. Okay, so then anesthesia, we'll turn the head, and we will have somebody up there to do that. But they will turn the head and kind of keep the drapes big and loose, so we don't have to redrape, and we're gonna start over again.
That's the string.
Poop on the elevator.
That's
Yeah.
green. Alligator's green. Drops. And I'll take I've changed my mind, I'm gonna have a shank here. Straight shank. Okay, now drops. Drop, drop, but stay high.
Okay.
Cotton? Okay, so I'm done. For you to clean up, what you wanna do is pull your suction tip off, because the rest of this is gonna be trash, okay? And kinda push that back and out of the way. And then come up here and grab all your drapes, that'll go in the trash, get in your suction, kinda all together. Okay, and what we didn't do was count, so let's do a quick count. We'll do our closing count.